Hi, everyone. We're here with one of our lovely patients who had an opportunity to sit down with us and tell us about her experience with us. So, with that being said, I'll turn this over to you. So, um, yeah, okay, yeah. Ro is here with us today, and she's going to really just talk about our experience together, the journey that we've gone on together. So, Ro, tell us, what were your initial thoughts about getting breast reconstruction and coming to our practice?
Well, I had been when I was diagnosed with breast cancer, I went on this journey of trying to find the right fit for my husband and I, and just making sure that we were comfortable with the process. And so I had gone to doctors previously, and I just didn't feel right. And so then that led me to my breast surgeon. And when I met with her, she recommended you. And so when we got here, immediately it just felt different for me. And I felt comfortable, and I felt like, I had found where I needed to be. And once we got here, I was able to have a conversation with you to help me decide what the best procedure was moving forward, so that I felt comfortable in what was going to be happening to my body.
Can you tell or describe a little bit about the consultation process that we had?
So when I got here, Pam was here to greet me, and she offered us water and tea and coffee and just did everything she could possibly do to kind of set my mind at ease and make sure that I understood that I was now part of your family, and that I was what I wanted was important. And so she brought me back, and then I saw you, and you were so warm and so welcoming and humble, and really just you sat with me and kind of listened to what it was that I felt like I needed and wanted for myself, and talked about my family history and what that meant. And you valued what I said, and you made me feel like whatever it was that I wanted was not too much to ask for, which was not the experience that we had had with the other people that we had consulted with previously. And so then we came, you came and brought me into your conference room, and you showed us pictures, and you really kind of step by step laid out the process of what that was going to look like, and what that was going to feel like for me. And you spoke with my husband, and you treated us as though we were a team, and you valued both of our opinions and what made us comfortable. And that day I felt like I could have sat with you for an hour or 2 hours, and it was never going to be too much for you. You continued to ask me, do you have anything else? Are you feeling okay? This is an overwhelming process. Do you need anything from me? You can always call our office. And when we left our consultation, I looked over at Chad and I said, we just found our team. And it was such a great feeling for us. And we never looked back. Then from then on, we just knew that we were in your hands, and we were in our breast surgeon's hands, and we were able to kind of breathe. And so it was a wonderful first meeting.
Fantastic. Well, thank you so much. How do you think your post-operative experience and recovery aligned with the things that I laid out for you as far as what to expect there?
Well, I chose to do a double mastectomy with an immediate deep flap. And so I felt like you had prepared me thoroughly for that. And but as far as the recovery, the hospital that we were at, they were so thorough, and they were so detail oriented, and I was never alone. And then I would get to see you in the morning, and you came and checked on me and your associate when you were not, able to. And so I felt like I was in great hands, and the experience was actually better than what you described to me. It was better than what I had planned and expected for myself. I expected more discomfort. I expected more emotions. I expected to really be mentally, it was uncertain, and when I was done with surgery, I felt relief. I felt like I was being managed, the pain meds being managed. I felt like I was again in great hands. And so it was, for me, it was much better than I had hoped. And I was able to walk around the next day, and I was able to shower. I was able to walk up the stairs, go for walks while I was at the hospital. And then when I got home, I was in touch with your office, and we had plans to see each other 7 days later. And so I was just kind of waiting for my drains to come out.
Yes.
As every woman does, I think, in this process. And you had said to me, when your drains come out, you're going to feel even better than you feel right now. And I did. So
That's great. Yeah, it's a team effort with a lot of other doctors, nurses, care providers. So just one piece. And of course, very happy that things went very well for you. When you look back on where you were before the process and where you are now, are you back doing your daily activities? How long did that process take for you?
I would say that I am back 99%. The process was swift for me. I mean, I was able to walk around my house shortly after surgery. I was able to go for short walks after we met on the 7th day. You cleared me to start going for longer walks. So I really took advantage of everything that you suggested that I do. And then also what my breast surgeon recommended. I did go to PT, which helped get my strength back and to get my mobility back. And I was able to resume my activities again as soon as you told me I was cleared for certain things. Then I started doing those things, and now I feel like breast cancer was just a step in my life. It was just one part of my life. It doesn't define me in a negative way. It is that I am a survivor, and I can say that, and I feel fantastic about that. And I'm ready for, the next phase that comes next. I'm ready for that.
How do you think your life has changed since the procedure?
I would say that I realized that I am stronger than I thought, and it helped my marriage. It helped me realize, my husband was there for me, and my family was there for me, and it just gave me an awareness and an appreciation for what I have, and also what other women have gone through. I didn't have to go through so many things that other women have had to go through. And so when I initially was diagnosed and I realized I didn't need chemo, I almost, for a little while, I felt like I wasn't worthy of being called a survivor, because I didn't have to experience those things that other women have had to endure. And I didn't feel like I could be in that class or in that group. And what I realized, again, through support from my family and my doctors, that everybody's journey is different, and what somebody else goes through does not minimize what you have gone through. And so whatever stages you have to take and whatever steps you have to take to get to the end, be thankful and be grateful and cherish all of those things, and don't minimize yourself.
Awesome. Just to build on that, breast reconstructions, there are multiple options. There's tissue-based reconstruction, implant-based reconstruction. You, of course, chose tissue-based and the DIEP flap. It's a scary option for some women because of the recovery or the incisions and all the things that are involved. What advice would you give to women who are maybe considering that or scared about doing that and decide to do implant-based?
Because I have a little bit of a family history of breast cancer, I always kind of knew what I wanted for myself. So that helped in the process. Coming to you hearing me, you telling me that what I wanted was not too much to ask for. And you said to me, I want you to know it's a little bit more work in the front. So you're ready for it. You're strong. You're ready to do this. It's going to be a little work. It's going to be a little bit more discomfort in the beginning, but what you're going to get out of it is going to outweigh that. And you were right. And so for me, implants were not something that I wanted. I didn't want to have to worry. I didn't want to have to keep coming back to have things checked or to have new implants put in or things like that. So it was the right decision for me. I would say to anybody that is thinking about it, I would say you are strong enough. You can do this. It is a little bit more work in the front, but I would say that I recovered really well and quite quickly. My scars are fading, and I'm going for phase 2 just to touch things up. I think that my breasts look beautiful, and they and my stomach looks fantastic. My belly button is healing well. So there are things that, again, you prepared me for. I wasn't thinking about a new belly button, or it's not exactly a new one, but I wasn't thinking about that. I was prepared for the scar, but I was so happy with the way that it looked, and just the cosmetic part of it and the extra time and effort that you put in to make sure that when I was done with surgery, it was something that I could look at and be proud of. And again, it's who I am. It's who I am now, and that makes me happy and proud and always thankful.
We thank you. Ro, would you recommend myself an AMG plastic surgery to others?
I have said since the beginning, I couldn't recommend you anymore. I would shout it from the rooftop. And I don't mean that as like I'm pumping you up. I mean that genuinely. You are humble, you are thoughtful, you are kind, you are perfectionist, you are patient. And when I'm saying it again, when we left your office that day, I felt peace, and I felt like we found our place. And Pam is amazing, and Faye is great, and just your team in general, they are so calming and reassuring, and that has helped us immensely.
When you think about our team, what do you think are some of the things that we did well?
I think the consultation process was top notch. I loved that you brought me into the conference room, and then we looked at pictures of my breasts and my stomach, and you showed me what was going to change about that and what was going to happen. You showed me what others look like. You were very clear that this is what some women look like. You may not look exactly like this, and you won't. Yours is going to look a little bit different, and that's okay. I felt like after we left there, I could call you at any time. And so that part was really reassuring. I had not had that experience before. When we were in the hospital and my nurses were saying, your incisions look fantastic. I mean, Dr. Ghaznavi did such a great job. And you are not very well known at that hospital. It's not a hospital that you frequented. And so when they looked at me, they just were so impressed with the work that you had done. And then you came in and I told you what a great job you did. And you were so humble and you were like, I thank you. But, and then always answering me promptly. Anything, when Pam said, you are part of our family now, anything that you need. And I loved that I called you, and it was a Friday night, and I called and I said, I know that Dr. Ghaznavi I don't mean to be calling you right now. And I know that you had shared with me you were going to a game. And I thought, I don't want to bother him, but I need to know this answer. And I got a text message back from you reassuring me. Within an hour, I got a message from you saying, please don't worry about contacting me right now. You come first, and then you answer my question. And then I just felt like, who does that, right? Who does that? And so in addition to all of those things, it was also your ability to know what I needed before I really needed it, and also to talk to me about what the next phase would look like and whether or not that was a choice that you made sure I knew that was a choice that you have. I'm here with you. I will make sure that you are happy with your results. And you have always asked me, are you happy? Are you okay? How is your emotional well-being? How are you doing? And that, I think, sets you apart from me. That's something that when I recommend you to somebody else, that is what I focus on for myself. Not so much he's a great plastic surgeon, you are, but the other parts of you make you so much better than just your great work as a plastic surgeon.
Thank you so much. I think holistic approach to plastic surgery is really important. Not only just the cutting aspect of it, but the rest of the emotional experience that people go through. Is there, I think we touched on this before, but is there any final words you would say about women in general deciding between reconstruction or not having reconstruction in the scheme of things? Because it's surprisingly something that a lot of will decide not to do at all. And we're not even talking about going flat, which is a type of reconstruction, but we're talking about just not doing anything.
I would say that you have to do what you're comfortable with as a woman, and every woman is different. I would suggest that you do your research and that you ask the questions and you make a list. And and if your surgeon doesn't feel comfortable having those conversations with you, then they're not the right person for you. And so make sure that you are 100% comfortable with what it is that you want. Take your surgeon's advice. Be open to different ideas. But also, if you are confident in what you want, then don't settle because you think that what you're asking for is too much, because it's not too much. And also be open to the different types of reconstruction that are available to you. As I said, I knew what I wanted. I knew what I was comfortable with. And so that made it a little bit easier for me. If I wasn't as confident and comfortable with the decision that I wanted, I would have relied more heavily on on Googling and doing things like that. But I didn't feel like after we met, I needed to search any farther in that process. I knew. And when you told me that that was something that I could do, and again, it's going to be a little bit more in the front, but you're ready for this. Your body can do this. I felt like I didn't need to kind of think anymore. I was done with that decision. And when you know what you're going to have and you know what you want and you know what's going to happen, the peace that you get, and you really do just have to trust the process of it and know, and then stop second guessing yourself.
That's great. That's really important advice. I think just having that conversation. Laurel, thank you so much for sitting down and talking about your experience. It has truly been one of our pleasure, myself, Pam, and the rest of the team to take care of you. We're honored in your trust and your confidence in us. And as we said to you before, you are now part of our family, and you will be for the rest of our lives. So we thank you and we appreciate you very much.
Thank you.
Welcome. Thank you.